Hello dear friends, welcome to KAPS Recalls discussion. Let's begin with today's session. Question number 86. All of the below statements are true regarding hemophilia except the options are inherited bleeding disorder, have low levels of either factor 8 or factor 9, occurs due to deficiency in hemoglobin, disease with an X-linked recessive inheritance pattern. So in the question they have asked about the wrong statement regarding hemophilia. Okay, so here the correct answer is option C, that occurs due to deficiency in hemoglobin. Remaining all other options are correct regarding hemophilia. Hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. So as a result of this, it can lead to spontaneous bleeding as well as bleeding following injuries or surgery. We know that our blood contains many proteins called clotting factors that can help to stop bleeding. People with hemophilia have low levels of either factor 8 or factor 9. Hemophilia is caused by a mutation or change in one of the genes that provides instructions for making the clotting factor proteins needed to form a blood clot. This is also a sex-linked recessive disease which shows its transmission from unaffected carrier female to some of the male progeny. There are two main types of hemophilia, that is hemophilia A and hemophilia B. Hemophilia A occurs due to low levels or due to deficiency of clotting factor 8, whereas this hemophilia B which occurs due to not enough clotting factor 9. Next question. Capsaicin can be used in. The options are relieving pain of herpes zoster, post-herpetic neuralgia, diabetic neuropathy, all of the above. So here the correct answer is option D, that is all of the above. That is capsaicin is useful in all of the conditions given as options. So this capsaicin is a topical analgesic agent used for the symptomatic relief of neuropathic pain associated with the post-herpetic neuralgia as well as other muscle and joint pain. Topical capsaicin cream is safe and effective in treating painful diabetic neuropathy. Neuralgia is a pain that comes from the nerves near the surface of your skin. This pain may occur after an infection with a herpes zoster, also known as shingles or post-herpetic neuralgia. Capsaicin will help relieve the pain of post-herpetic neuralgia, but it will not cure the condition. It can stop the nerves sending pain messages to the brain. You can apply it to the affected area a few times a day, but only when the rash has healed. It works by changing the way the nerve endings function. Capsaicin is also used to help relieve minor pain associated with rheumatoid arthritis or muscle sprains and strains. Question number 88. Hyperreflexia is associated with which of the following drugs? The options are dopamine antagonists, MAO inhibitors, that is monoamine oxidase inhibitors, benzodiazepines, calcium channel blockers. So here the correct answer is option B, that is monoamino oxidase inhibitors. Hyperreflexia occurs when your skeletal muscles have an increased or overactive reflex response. Damage to your motor neurons that transmit signals from your brain to your spinal cord causes hyperreflexia. This is called an upper motor neuron lesion. But there are certain other non-neurological conditions like anxiety disorders and hyperthyroidism can cause hyperreflexia. Neuroleptic malignant syndrome and serotonin syndrome are rare but potentially life-threatening medicine-induced disorders. Features of these syndromes may overlap, making diagnosis of these conditions difficult. The presence of neuromuscular excitation such as clonus. Clonus means involuntary rhythmic muscular contractions and relaxations. And hyperreflexia are strongly predictive of serotonin syndrome. In contrast, neuroleptic malignant syndrome is characterized by muscular lead pipe rigidity, hemodynamic dysregulation, and hyporeflexia. Precipitating medicines also allow differentiation. Dopamine antagonists precipitate neuroleptic malignant syndrome, whereas the serotonergic medicines are indicative of serotonin syndrome. So this hyperreflexia is a characteristic feature of serotonin syndrome, which is exhibited by serotonergic drugs, whereas this muscular lead pipe rigidity is a characteristic feature of neuroleptic malignant syndrome, which is shown by dopamine antagonists. Next question. Therapy which can cause diabetes insipidus. The options are warfarin, lithium, hydrochlorothiazide, metronidazole. So here the correct answer is option B, that is lithium. We know that lithium is an anti-maniac drug that is mainly used for the treatment of bipolar disorder. Lithium carbonate is a well-documented cause of nephrogenic diabetes insipidus, with as many as 10 to 15% of patients taking lithium developing this condition. Lithium can cause renal impairment by inhibiting ADH, that is antidiuretic hormone, from acting on the renal tubule by means of interrupting the medullary osmotic gradient by ADH. This is due to the similarity of lithium ions have in terms of chemical properties with the sodium ions. This enables them to be accumulated in the endothelial cells of collecting ducts. So when a patient is on high dose of lithium treatment, it will lead to impairment in water absorption, leading to diabetes insipidus, which further exacerbates dehydration and consequently increases the serum lithium concentration. So this diabetes insipidus is a condition caused by problems with a chemical called vasopressin, that is arginine vasopressin, which is also known as antidiuretic hormone. This arginine vasopressin is produced by the hypothalamus and stored in the pituitary gland until needed. This AVP regulates the level of water in your body by controlling the amount of urine your kidneys produce. So in case of diabetes insipidus, this ADH or this vasopressin fails to properly regulate your body's level of water and allows too much urine to be produced and passed from your body. There are mainly two types of diabetes insipidus, that is cranial diabetes insipidus and nephrogenic diabetes insipidus. Cranial diabetes insipidus means where the body does not produce enough ADH, so excessive amounts of water are lost in large amounts of urine. In case of nephrogenic diabetes insipidus, where AVP is produced at the right levels but for a variety of reasons, the kidneys do not respond to it in the normal way. Okay, so next question. Which anti-epileptic drug is considered to be safe in myasthenia gravis patients? The options are lacosamide, phenytoin, phenobarbital, gabapentin. So here the correct answer is option A, that is lacosamide. So what is this myasthenia gravis? It is an autoimmune disorder, which means an antibody developing against nicotinic receptors in the skeletal muscles, that is in the neuromuscular junction. Anti-epileptic drugs have been known to worsen myasthenia gravis symptoms, and therefore in patients who suffer from both conditions, that is myasthenia and epilepsy, treatment selection is difficult. Cases suggest that lacosamide could be an effective alternative that is potentially well tolerated for treating refractory neuropathic pain and epilepsy in patients with myasthenia gravis. Lacosamide was the only anti-epileptic for which no myasthenia-related ADR was included in the database, and there was a marginal signal for a lower than average risk. So with this question, we have completed today's recall session. Thank you for watching this video. Have a good day.